Good evening again, everybody. I want to welcome you to Barasch McGarry's webinar this evening on breast cancer. This is Breast Cancer Awareness Month. We have a lot to talk to you about tonight. We're honored to have Dr. Paul Barron join us. Dr. Barron is the Chief of Breast Cancer and the Director of the Breast Cancer Program at Lenox Hill Hospital, which is run by Northwell. Also with me this evening are my partners, Dana Cohen, Dom Penson, and Lee London. And we're going to start with Dr. Barron, who's going to discuss breast cancer awareness. And Dr. Barron, I'll let you get right to it.
Well, thanks for this opportunity to talk to you. During this talk, I'm going to give an overview of cancer incidence. I'm going to talk about the risk factors for developing breast cancer. I'm going to talk about how breast cancer is detected and diagnosed. I'll touch on the surgical treatment of breast cancer. And finally, I'll talk about the role of systemic therapy and radiation therapy. This is data from the American Cancer Society website, and it's basically showing that in 2020, it's estimated that there'll be close to 2 million new cases of cancer, all cancers, in the United States, of which, unfortunately, about 600,000 will go on to die of their disease. And what that translates to is there's about 5,000 new cancers every day in the United States, and about 1,600 deaths. Again, this is all cancers, not just breast cancer. When you look at the cancers by disease, again, breast cancer, when you combine both men and women, is the #1 cause of cancer in the United States, followed by lung cancer. Fortunately, we do a fairly good job at treating breast cancer. Only 40,000 of those pass away from the disease. Certainly, that's way too many to begin with, but certainly better than we had thought. The #1 cause of cancer death in the United States is still lung cancer. And we have a long way to go on that, though we've made improvements with that too. So when it comes to breast cancer, there are two sets of risk factors. There are those that you actually can do something about that you can change, and then there are those that you really can't do too much about, you're born with. So when it comes to things you can change, it turns out that even a small amount of alcohol increases your cancer risk. So it's generally recommended that women should keep to about 1 drink a day. Certainly every now and then more than that's fine, but in general that should be the goal, is no more than 1 a day. A modest weight loss will reduce your risk of breast cancer. Being physically active decreases the risk of breast cancer. And being careful with your diet will lead to a 21% lower risk of death from breast cancer with a balanced low-fat diet. And there is also evidence that combination hormone therapy will increase the risk of breast cancer for postmenopausal women. Unfortunately, there's some things we actually can't do anything about. Being a woman is the #1 risk factor for developing breast cancer. There's about 280,000 breast cancers each year in women, and there's about 2,600 in men. As people get older, the risk of breast cancer increases, but unfortunately, we certainly see breast cancer in younger women. Having dense breast tissue increases the risk of breast cancer. Early menses and late menopause, so a longer period of hormone exposure, increases the risk of breast cancer. Having a previous biopsy that's found to have atypia will increase the risk. Having previous radiation to the chest, and this isn't just x-rays, this is not just chest x-rays, this is things like Hodgkin's disease or non-Hodgkin's lymphoma, actually treatment for cancer, increase the risk of breast cancer. And finally, as everybody knows, a strong family history of breast cancer increases your risk, especially if you inherit a gene mutation. Unfortunately, if you don't have a family history of breast cancer, that does not protect you from getting breast cancer. So that's always something that upsets people when they develop it. So what this shows is many people have heard about these BRCA mutations. These are breast cancer genes, BRCA1 and 2. If you have a BRCA mutation, your risk of getting breast cancer by the age of 50 is as high as 50%, compared to the average population. The breast cancer risk is only 20% to that age. Up to the age of 70 is as high as 87%. And also, unfortunately, these patients also have an increased risk for ovarian cancer. Fortunately, we've learned even more about genetics in breast cancer. In addition to BRCA1 and 2, there's a total of 11 genes that increase your risk for breast cancer. So when we do genetic testing, most of the time we do what's called panel testing. This is where we look at 11 different genes. The BRCA1 and 2 are here, and these are called high-risk genes, because the risk, as you've heard, is as high as over 50%. But there's also now a number of moderate risk genes, such as TALB2, CHEK2, that if you have these, your risk of cancer is higher than the average population, but not as high as BRCA1 and 2. So who should get genetic testing? The list is fairly long, but if you've been affected with breast cancer, you've had breast cancer, you're under 45, you should have genetic testing. If you have what's called a triple negative breast cancer, you should have genetic testing. If you're Jewish of Ashkenazi descent, it's very significant. It turns out when you look at all patients, all women in the United States, the chance of carrying a gene mutation is about 1 in 500. However, if you have Ashkenazi Jewish descent, which is what most Jews come from, the risk is 1 in 40. So it's a tenfold higher risk of getting breast cancer. Also, anybody with ovarian cancer, increased risk of having a gene mutation. And finally, if you yourself don't have breast cancer, but you have first-degree relatives, such as a mother, sister, or daughter, that meet these criteria, you actually now qualify for genetic testing. In the past, the insurance companies didn't approve it, but now they do. So how is breast cancer detected and diagnosed? Certainly having a history of a breast problem, patient has strong family history is how a lot of people present. Physical exam is important. Breast imaging studies, mammogram, ultrasound, MRI. And we always try to get a diagnosis ahead of time with a needle biopsy. We don't like to take people to the OR without a diagnosis. So findings of physical exam, certainly having a lump is the most common presentation if you have a physical exam finding. We still, these days, find most breast cancers on mammogram, so mammogram does make a difference. If there's evidence of pulling of the nipple, so-called retraction or dimpling or nipple discharge, these are things that do identify somebody who may have a breast cancer present. Currently, the American Cancer Society has released these guidelines, and what they're saying is that when you hit 40, you should begin having a discussion with your doctor, and you basically should begin having an annual mammogram at the age of 40. And it's very important throughout the 40s until about the age of 55, having a mammogram every year. There is some evidence from other countries where if you do it every other year after the age of 55, it's just as good. However, we have good data here that you have an increased risk of finding breast cancer if you do it every year. And certainly you should continue to have mammograms every year until you get to the point where you have other medical conditions and it's not, breast cancer is not as serious a problem. So what this data shows is that fortunately, we actually have made a big impact on death rate due to breast cancer. And what this shows is mammography has led to a drop in breast cancer mortality from about 70 per 100,000 down to 40. So it's a big difference. We've saved over 400,000 lives during this 20, 30-year period. And so mammography does make a difference. So this is just an example of a patient of mine who has a sister with breast cancer who was relatively young. Her mammogram actually in this case was very dense, so it was actually hiding a cancer. So even though we do find most breast cancers on mammogram, occasionally if you have a patient who's got dense breast tissue or a strong family history, they're considered what's called high risk, and those are patients who will do more than just a mammogram. So in this case, she actually had an MRI, and what this shows is that the plain before contrast, when the contrast is given, this small spot lit up. And so that was biopsy and turned out to be a small early breast cancer. So something that's very important now that we're all in this pandemic is that this editorial just came out a couple of months ago in Science. And what's happening is at the height of COVID, most mammography centers were shut down. You couldn't get a screening mammogram. But because of COVID, a lot of people are not going in and getting their routine screening mammograms. They're putting it off. They're also putting off their routine colonoscopy. And this editorial has shown that over the next 10 years, it is estimated that there'll be an extra 10,000 deaths due to colon and rectal cancer because women are not getting the screening mammograms, men and women are not getting the colonoscopy, and those who actually have a problem on their breast, they're not showing up to their doctor. So if you have a problem, go get seen. If you're due for your screening tests, please get them done. So it comes to breast cancer treatment, it's a combination of surgery, radiation therapy, and chemotherapy or hormonal therapy all have a role. Surgical options are either a lumpectomy, where we just take out the tumor, mastectomy, where the whole breast is removed, or what's called neoadjuvant therapy, where we give therapy first by vein or by a pill, shrink the tumor down, and then do the surgery. So when I do a lumpectomy, I try to do what's called hidden scar lumpectomies. This is where I try to place the incision around the areola or under the breast. And that way I take the tumor out, close it up, and that way there's minimal scarring. So not only are we treating the cancer, having a great cosmetic result, it makes a big difference for the patient. In addition to those patients who need a mastectomy for whatever reason, we actually nowadays try to do what's called nipple sparing mastectomy, where most often place the incision under the breast And that way, get all the breast tissue out, leave the skin of the breast, leave the nipple, and the plastic surgeon comes in and rebuilds the breast. So who should get a lumpectomy or mastectomy? Basically, it's important to know that survival is exactly the same. Mastectomy does not have a better survival, even though some people think it does. The data clearly shows the survival for lumpectomy is the same as a mastectomy. So mastectomy is really only indicated when the tumor is relatively large compared to the size of the breast, such that when you take the tumor out, the breast will be deformed. Or if they have multiple tumors in different quadrants of the breast, that you can't do multiple lumpectomies, or if they have a strong family history of breast cancer or a known gene mutation that increases their risk, those patients will frequently opt for mastectomies. In fact, those patients often will opt for bilateral mastectomies. When it comes to mastectomy, there's the standard total mastectomy, the skin sparing mastectomy, remove the nipple and areola, but leave all the skin of the breast, leave an envelope, or a nipple sparing mastectomy. There's generally 3 types of reconstructions. One is where a breast plastic surgeon comes in and puts in a tissue expander, and I'll show a diagram of what this is all about. Or they go straight to an implant, so-called one-step procedure, or they use your own tissue for the reconstruction. And this is what's so-called tissue expander. This is where at time of mastectomy, the plastic surgeon comes in and puts this kind of deflated breast implant either under the muscle or in front of the muscle. And after the wound heals up, they start injecting saline every few weeks to expand the space and then take them back, take out the expander, and put in an implant. And again, that implant can be in front of the muscle or behind the muscle and have a really good cosmetic result. Another option, which is very popular, is called the DIP, or deep inferior epigastric flap, where rather than using artificial materials such as an implant, you can use your own tissue, which is the fat from the lower abdomen, and it's brought up to the chest and it's sewn to these vessels in the chest. This is really only done by places and centers that have a lot of experience with it because it's a pretty technically challenging procedure, but there are a number of people in New York who do a really good job with it. One nice fringe benefit of it is you get a little tummy tuck in the process. Some people like that. Certainly the surgery is a lot more involved and the results are quite good. Most patients who have a lumpectomy also require radiation therapy. Some mastectomy patients also get radiation therapy. And finally, when we talk about chemotherapy, this is either adjuvant therapy, which is done after surgery, and this is based on the pathology of the tumor found, or neoadjuvant, which is done before surgery. And these are usually for high-risk cancers, usually to shrink the tumors down so they can have a lumpectomy, or in some cases, just to facilitate a mastectomy. Thank you.
Thank you very much, Dr. Barron. I'm really so appreciative of the fact that you stayed on tonight. I was so surprised to learn 3 years ago that men can get breast cancer also. I had no idea. We now represent 54 men with breast cancer. So can you just briefly tell us, is the treatment the same? What's different? What should men be doing? Because we don't go for mammograms.
Right. Yeah, so the treatment for male breast cancer is basically the same as female in the sense that, let me back it up. It's not so much the treatment is the same, but the outcomes are the same. In other words, somebody with a 2-centimeter cancer in a woman with negative nodes is going to have the same results in a 2-centimeter cancer as a man with negative nodes. The difference is, as you just alluded to, men are not getting screening mammograms because it's so rare. There's no evidence that screening mammography helps in men. So we usually see male breast cancer as a palpable lump, something they can feel, whereas many women's breast cancer are showing up as only an abnormality in the mammogram, so it can be very small, it can be a couple of millimeters. On the flip side, when it comes to surgery, where women, because the cancers can be relatively small, we frequently could do a lumpectomy, take out the lump, and the breast looks pretty normal. With a man, most treatment is still mastectomy, where we remove the entire breast and close things up. On occasion, you can do a lumpectomy in a very large breasted man. But most of the time, mastectomy is what gets done in men. But it's basically, the survival has to do with the details of the cancer, the size, the aggressiveness of the disease for a man versus a woman.
So let's talk a little bit now about 9/11 and the presumption by the National Institute of Health that if you were a downtown office worker, a responder, a student, a teacher, and you do have breast cancer or any of 68 other cancers, the presumption is that your cancer was caused by your exposure to the World Trade Center toxins. And by presumption, I mean, all you have to do is prove that you were diagnosed with breast cancer after September 11th, 2005, and that you were there. So let's go into that with the video, please.
The first thing that I hear from the non-first responder community in Lower Manhattan is, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
So as you heard Senator Gillibrand, this is the map that's put out by the federal government. The area in blue, which encompasses some of Western Brooklyn, anybody within that entire area, the blue or the yellow, who was in that area either as a responder, office worker, student, teacher, downtown resident, is entitled to free health care for the rest of your life. And thank you very much, John Stewart, because really without him, this would never have happened. And last year, I don't know how many of you were watching the news, but John Stewart was in Washington. We were sitting behind him in the Judiciary Committee when he testified so eloquently. And now Congress has passed a law extending the Victim Compensation Fund. But for that, to be eligible for that, you have to have been below Canal Street or at the Fresh Kills landfill or any of the morgues or at any of the debris removal sites. And I can't tell you exactly why the 2 maps are different, but it was negotiated in Congress. And we're very grateful, at least, that everyone in the 9/11 community now who was exposed to those toxins will get free health care. And most will also get compensation, God forbid they get sick. All right, Lee, would you take us through some of the most common illnesses?
Sure. And thanks so much. So right now, what we're seeing in the 9/11 community, as Dr. Paul Barron has stated, is obviously the prostate cancers, the breast cancers, the thyroid cancer, and the biggest hurdle that many people have to get over is the fact that their private doctors are not linking their cancer diagnosis to their 9/11 exposure. That's why we are encouraging everybody to join and take advantage of the benefits of the World Trade Center Health Program. You're going to be with experts. You're going to be with people in the 9/11 community that know 9/11 exposure. And just like Michael stated before, it is a presumption that if you were there during that time, you don't have to prove the causation. Your cancer, even if your family is known to have prostate cancer in your family, your presumption that it was caused by your 9/11 exposure. And the number one condition right now that we are getting calls about 19 years later, the 20th anniversary of 9/11 is right around the corner, is skin cancer, basal cell, squamous, melanoma, all covered by the Victim Compensation Fund and certifiable by the World Trade Center Health Program. But you must get a full body skin check. As Dr. Paul Barron has stated, because of COVID, many people haven't gone to their normal testing. And that is something we are trying to encourage right now, just because we are seeing a huge increase in skin cancers among the 9/11 community, as well as non-cancerous conditions such as interstitial lung disease, sarcoidosis. The 9/11 community, because of COVID, you are immune compromised. You have to protect yourself on a daily basis. And another way to protect yourself is by getting screening. Early detection is key, especially with these 9/11 cancers that are much more aggressive. So we're really just trying to make sure people take advantage of these benefits and also get a full body skin check, because they're not going to give you one at the health program. When you go in for your yearly evaluations, you must show them if you have any issues. And please go to your local dermatologist and get this full body skin check, because it could save your life.
Thanks, Lee. I also want to emphasize the fact that if you like your doctor, if you have cancer and you like your doctor, stay with your doctor. There's some wonderful doctors, including those at Lenox Hill Hospital. But the health program there is to support you. They're there to certify your illnesses, because as you'll learn in a moment, once you get certified, all your copays, all your deductibles are covered for the rest of your life. Lee, tell us a little bit about the deadlines for the personal injury claims.
Sure. So with the Zadroga Act, it broke down these two government entities that work together, but they're separate. You have the World Trade Center Health Program on one side, and you have the Victim Compensation Fund on the other side. The Victim Compensation Fund offers you a monetary award and has so many benefits to it for pain and suffering, loss of earnings, but there are two big registration deadlines approaching in July 29th of 2021. And one of the biggest is if you are certified by the World Trade Center Health Program already. And if you're not part of the 9/11 community already and you've never joined the health program, you're asking yourself, what does certification mean? Certification is the health program has certified that your cancer, your respiratory condition is linked to your 9/11 exposure. And if you've been certified for a condition, because many people have been part of the health program, and you don't register for the VCF within 2 years from your date of certification, you cannot file a claim after July 29th of 2021. So we are encouraging everybody to register for the Victim Compensation Fund. If you're certified, if you might be certified and don't even know it, register to protect yourself.
All right. Okay. So this is a slide. Dr. Benjamin Luft of the World Trade Center Health Program is encouraging everybody to be careful. As Lee talked about before, if you have respiratory illnesses, you are more at risk. If you've had cancer and chemotherapy, your immune system is not that of a healthy, normal person. So please wear a mask. Listen to the scientists. Please social distance. This is not a political issue at all. Okay, so you've heard that the exams, the annual exams are free. If you are diagnosed with a 9/11 respiratory illness or cancer, the World Trade Center Health Program will give you a certification letter that we can then use, or any attorney can use, to help you get compensated by the Victim Compensation Fund. And as I alluded to earlier, once you're certified, all your out-of-pocket medical expenses and deductibles are covered for the rest of your life. And it doesn't matter where you live. We have so many of our clients who live in New York, but then go down to Florida or North Carolina or Arizona or California. They're snowbirds. There are facilities in all 50 states. They've tried to make this as easy as possible for you. Take advantage of these programs.
Great. So the Victim Compensation Fund is an unbelievable program. And Michael and the firm has spent so much time, especially last year, going to Congress to make sure that this program, just like the World Trade Center Health Program, will outlive us all. This program has been extended till 2090. So The benefits from the Victim Compensation Fund are you can make an award for pain and suffering of your condition, out-of-pocket medical expenses, loss of earnings claims. We have many stockbrokers, people working on Wall Street. We have many cops, firefighters, first responders, and survivors where their conditions cause them to leave the workforce, and you can make a loss of earnings claim directly to the Victim Compensation Fund. Just as well as that, you can make out-of-pocket medical expenses, which means that to treat 9/11 conditions can get very expensive. So we encourage everybody to save all their receipts, anything that you pay for out of pocket, because if you're not part of the health program yet, which would cover it for you, we can make that claim directly to the VCF to get you reimbursed for those out-of-pocket medicals. Talking about non-economic loss claims of pain and suffering, they can range because not everybody goes through the same treatment. Everybody is different. So you can have two people diagnosed, let's say, upper respiratory condition. One person uses a nasal rinse once a year. The other person has had 5 surgeries. The Victim Compensation Fund looks at the severity of your condition. That's why awards can range from, for non-life-threatening illnesses, $20,000 to $90,000. For skin cancers, I spoke about that before. Basal, squamish, melanoma can range from $90,000 to $250,000 as your award, and all life-threatening cancers such as bladder cancer, lung cancer, lymphoma, breast cancer range from $200,000 to $340,000. So you must be each other's advocates. You must get the word out to your retirees that might have moved away, to families that may not be taking advantage of these benefits that are out there. As a first responder, as a survivor, as a resident, you're all entitled to these benefits from the World Trade Center Health Program and the Victim Compensation Fund.
All right, Dom and Dana, would you speak to this, please?
Sure. One thing you should understand is that the VCF, which is the compensation part of the program, has not always compensated cancer. Most of the 68 cancers that are now deemed eligible for compensation were added in 2013, many years after the VCF was started. So there are a lot of people who once upon a time may have asserted a VCF claim for one of the respiratory illnesses at a time and received compensation at a time when, if they then succumbed to a cancer, their families couldn't assert a claim for that. The law has changed, and now cancers, 68 of them, are eligible, which means that if somebody passed away even before the law was changed, their family can still take advantage of the change today. And this is where that deadline that we were talking about before becomes so important, because after next July 29, 2021, there will be a deadline. The deadline will be that any claim for wrongful death will have to be brought within 2 years of the death. But until then, there is a window open, and that window allows families of somebody who passed away more than 2 years ago, even 10 years ago or longer, to bring a claim prior to July 29, 2001 for that wrongful death. And if you bring such a claim, you are entitled not only to an award for the death and the consequences of that, pain and suffering for the death of your loved one, of the decedent, lost earnings for the time that the person's career was cut short after their death, something called replacement services for the things that the services that they could no longer provide for their loved ones, for their dependents and the members of their household. And you're entitled to have funeral expenses reimbursed. In addition to those deceased claim awards, you would also be permitted to obtain an award for the personal injury that the person might have been able to bring while alive. So for the pain and suffering and the lost earnings that the decedent experienced prior to passing away from the 9/11 illness. And when you add it all together, these awards can be quite substantial. They can add up to hundreds of thousands and millions of dollars. Now, there are 2 classes of people. And the second class of people is the rest of us. And by that, I mean that we will all of us who are in the 9/11 community, we will all one day pass away from something. When I was a kid, if you lived long enough, people said that you died of old age. Of course, nobody dies of old age. People pass away from something. It might be heart disease, it might be some kind of cancer. And if we, the members of the 9/11 community, pass away one day, however many years from now, from one of these illnesses that have been recognized, that have been linked to the toxic dust at 9/11, our families will be allowed to bring a claim to the VCF and will be entitled to these benefits that we've been talking about. And there is something that we can all do today to prepare for that eventual day. And Dana is going to talk to you about that.
What Dom and I want to talk to you about is how to protect your family's legal rights. Because families who have lost someone to 9/11 disease are entitled to substantial benefits, but they have to know about their rights and they have to know how to access them. And we have learned some very, very important lessons doing this work about what all of us can do to prepare and to make sure that our families can get what they are entitled to. And we wouldn't be doing our job if we didn't share those lessons with you. So the first thing I want to tell you is that you have to talk to your family. Talk to your family and make sure they understand what they're entitled to. If you are a member of the 9/11 community, then they have to know that if you pass away from one of these diseases, if any of us in the 9/11 community do, they have rights. And let them know that there's a presumption. Let them know that a doctor doesn't have to make that connection. That's what a presumption is. Let them know that there are lawyers available to help. They don't have to take this on all by themselves. And let them know that there are registration deadlines. And if they are too late, they may miss out on their right to this compensation. I think being a part of the program now is one of the best things that you can do for your family. If you're in the health program and your condition is certified, and then you go to the VCF and the VCF deems you eligible, then your family will not have to go through that step down the line. It could be 10 years, it could be 20 years, it could be 50 years. They won't have to do it. And so as time goes on, it becomes harder to find the proof necessary to make these claims. So doing it now is important. And if you aren't going to do it now, find your witnesses. One of the things that all of us who apply to the Victim Compensation Fund will have to do is come forward with 2 affidavits from witnesses who saw us there. And as we're getting further from 9/11, it's 19 years now, it's harder to find those people. And for our families, that job is doubly hard because they weren't there, they don't know who was with us. And so we have to identify those people and we have to find them now and we have to get those affidavits. And the last thing, and this is a lesson that unfortunately we've seen many families learn the hard way, get a will. And if you have an old will, update your will. The reason you want a will is because in your will, you'll name your executor. And your executor is the person who's going to be able to bring this claim. You will have spoken to that person. That person will be the person that you think is best qualified to handle this. Part of this award is going to pass through the will. So if you don't have a will, it's going to pass by intestacy, which is basically a formula that the government has set up. So if you know where you want the VCF, or at least the estate's portion of the VCF money to go, then you have to have a will to make sure that happens. If you don't, it might not go where it's most needed. Having a will also make the process much faster and smoother for your family. So there are other things I could share with you, but I think those are the most important things to know. One last thing I want to say, and that is that don't let the process feel too daunting, and don't let it stop you. It can, if you're running into a brick wall looking for witnesses, there are lots of creative ways to find people. You don't stop at, I can't think of someone. We represent thousands of people, and very often we found witnesses for our clients who themselves couldn't come up with somebody, because we represent people who work in all kinds of industries, first responders, teachers, students, and we've been able to locate the people. So be creative, don't get discouraged. Lots of other families have gone through this, lots of other people have gone through it, and you can too. So what should you do? Obviously, register for the World Trade Center Health Program. Those are your health benefits. register with the Victim Compensation Fund. There's compensation available for you. Secure your evidence proving your exposure to the World Trade Center toxins. Even if you're healthy now, find your witnesses, get affidavits, and make sure those affidavits are sufficient. Take care of your health. See a dermatologist if you haven't done it. Do it yearly. Get your mammogram. Remember, early detection can make all the difference. We see it all the time. And get a will, get a healthcare proxy. Protect yourself, protect your family.
If you have any follow-up questions, if you want to talk to us privately, we're always happy to talk to you. All of our consultations are free. Take advantage of that, all right? And feel free to ask us any questions. We take it personally. We were 2 blocks from ground zero on 9/11. We lived it. We continue to live it every single day. Again, call us if you have any questions. Thank you very much. I wish everyone a safe evening.